it just seemed like every week I would gain and get better. And I had to realize that there were certain situations that always made my tinnitus worse. Don't give up on, trying to find help, but don't go to those things that, you know, that are just, overnight cure.
Today, we're joined by Brad, who will share his story of tinnitus recovery and how he used 3 tools for brain retraining. Just before that, we will cover the 4 things that he tried that did not help him much and hopefully save you time or money in your tinnitus treatment journey. Brad, welcome to the Treble Health Podcast. Brad, can you summarize your journey with tinnitus?
Yes, it was March of 21, and I was in my living room, and it just hit me. And I thought, well, this probably won't last more than 10 or 15 seconds, but it never went away. So that's where it started. Absolutely miserable until the summer of 23. I couldn't concentrate. I couldn't work. I did work, but it was not very pleasant. I didn't enjoy anything, family, friends. So that's what it was.
Brad, what were the things that you first tried once you developed tinnitus, and how did those go for you?
First of all, diet, nutrition, supplements. Essential fatty acids were one of the supplements. Medical grade CBD, tried that. Neosensory wristband, a little black wristwatch, and blue light therapy from my chiropractor, and none of it was successful.
Can you share with us what happened when you went to the doctor to get evaluated for, a potential physical issue with your ear or some kind of diagnosis? How did that process go?
My medical doctor said he wouldn't even refer me to an audiologist because he said you just have to live with it. There's no cure. The audiologist that I saw tried to help with some maskers, but they don't specialize in tinnitus. So they were kind of out of their league there. So no answers from the medical side, none at all.
What did the hearing test results show for you? Do you have a hearing loss, or was it normal hearing result?
Almost perfect. Very little in my right ear. Very little.
That's really tough when you're diagnosed with tinnitus and local doctors don't have a solution or don't recommend a specific treatment. Well, for anyone who's going through that, this would be just turning life upside down and I'm sure causing a lot of difficulty. Were you able to work? Were you able to maintain relationships with family and maintain some energy day to day?
Energy was the big loss. That was really hard because you don't want to get out of bed because you don't want to wake up because you don't want to hear the sound. Relationships, work, it all suffered greatly. I was able to maintain them, but it wasn't really with a smile on my face. Mm-mm.
This was not a small period of time in your life, correct? This was over a year, about 2 years, and I'm sure there were ebbs and flows, but from what I heard, this was near constant tinnitus. And man, I'm sorry, everyone here, Treble Health community, if you're watching this on YouTube, please comment community because we're all part of this together, and we know you're here to share your message to help others, Brad. So let's talk about the tools that you eventually found that helped with brain retraining. We got connected through Treble Health. You reached out to our team, and we ended up working with you. What was tool number 1 that moved the needle to reduce your tinnitus?
The sound therapy, for sure.
What is sound therapy and how did you use it?
The maskers that come with working with Treble Health. You set those up with your audiologist from Treble Health, and they adjust the noise. I don't want to call it noise, but the therapy level that you can hear coming out of the maskers, and it just worked. I mean, and the audiologist is always there to help. So it was a big deal for me.
Let's talk more about that. So what is sound therapy treatment exactly? What are these devices? Tell us more about what you used and what you heard.
Well, it's just a little earpiece goes in your ear on each side. I hear basically a white noise. It's a very soft white noise. And I even said to my audiologist, I said, you got to turn these things up. She said, no, you'll be all right. So she was right. It's a very gentle noise. It's not disruptive or disturbing.
Day to day, what was it like to listen to sound therapy with those devices in your ears, hearing the white noise type sound? Did it help immediately? Did it take some time? How did it affect your ability to work or be in quieter places? Tell us more about how it actually helped.
It took a little bit of time, and I had to realize that there were certain situations that always made my tinnitus worse, and driving is one of those. So when I'd start to make some progress with the sound therapy, and then, every day go drive somewhere and think I'm regressing, but I'm not, because pretty soon the gains just outweighed anything, to the point where it's really motivated me, because it just seemed like every week I would gain and get better. So it was just listening to it on a daily basis. You don't even notice it. I mean, after a couple of days, it just, it's like anything else. It's like drinking a glass of water.
Folks often describe it's like wearing glasses, right? Something that we put on our head or on our ears or behind our ears with glasses. Mm-hmm. And when folks describe using the sound therapy devices, there is an adjustment period of a few days to a few weeks where, I have something new on my body, just like wearing a new watch or wearing new shoes. But once that's habituated to, then the sound therapy can just be this background aid, this helpful tool. What was your time frame with sound therapy treatment in particular? How much time did it take for your tinnitus to calm down a bit? And was it the awareness? Was it the volume? How exactly did you know you were getting better?
Time frame, I'm going to say roughly 2.5 months, 3 months. And how I knew I was getting better is this would be top of my mind all day, every day. And then after, I guess it was, a week and a half, and I thought to myself, I haven't thought about this. Then I knew. I'm like, wow, that's really it. But yeah, then I knew that this was going to work out.
It shows us that the attention and concentration factor is such a pivotal function of the brain related to tinnitus, that if we don't think about a sound, we're not aware of it, then essentially it's not affecting us. It's not causing a problem. And we need to train the brain to do that for tinnitus. And the sound therapy devices are the best tool that I've personally ever seen that can do it. So I'm really happy to share your story here. That's not the only tool that you benefited from, though. So let's talk about tool number 2. What else helped you reduce your tinnitus, Brad?
The guided breathing. And what that really did for me, I do it at night in bed. And most of the time, before I can get through it, I'm asleep. It just completely relaxes you. But you got to really push it. I mean, you got to really expand your diaphragm. I mean, you can't just, lightly in and out. Like it said, you got to really go to the max. And if you do that, wow, it really helps.
Let's talk about the theory of this. So in your understanding, what's happening there? How could breathing help your ears? What did you learn about the relationship between your ears, your brain, your body? Tell us more about that.
It's just an overall relaxation. And when you have tinnitus, at least for me, the anxiety, the stress, and to have the breathing just calm you down and kind of recenter yourself and just, hey, this is going to be all right. It's really amazing.
It sounds to me like you put your body and brain in a position to succeed. It wasn't that you did anything to specifically address the tinnitus head on, but you put your brain and your body in a position that it could reduce the tinnitus for you in a way. Is that connecting?
It is, yes. And that's exactly how Suzanne explained it to me. We're not really going after the sound. We're going after your brain to not recognize it. You're not just going to put maskers in and have a noise overpower the noise that's in your head. It's retraining everything, rewiring your brain.
Exactly. And a few things that Brad had mentioned here. Number 1, Suzanne. He's referring to Dr. Suzanne May, who's an audiologist on our team at Treble Health. We have links below if you want to reach out and get connected with her or someone on our team. Please do. We have a free consultation for you. And the second thing was the masker. So the term masker might be a bit confusing because we're not actually trying to cover or completely mask the tinnitus. The brain needs to be aware of the tinnitus to some degree in order for it to reduce the sound over time. But the sound therapy devices are sometimes called maskers. So just wanted to clear that up. Brad, what advice would you have for someone who's never tried guided breathing or meditation but is looking for a tool that's actually going to help them reduce tinnitus, what advice would you have regarding the guided breathing exercises? Where should they start?
My favorite one is the 10 deep breaths. And I would recommend, I do it in bed before I go to sleep. If it's a really bad day, you might want to do them in the day, maybe even 2 or 3 times a day. They really calm you down. They really do. Do them. For sure. Do them.
In summary, there, the 10 deep breaths is something that one can come back to consistently to calm down their mind, settle the body, and that gives us a tool to reduce tinnitus. I love that tool because it's subtle and most people would not quite go there first. It's not something that people go to first. Yet you're describing, you've tried diet, nutrition, supplements, you've tried medical grade CBD drops, you've tried the neosensory wristband, you tried advice from your chiropractor and some blue light therapy. That didn't do much, but the sound therapy treatment, tool number 1, guided breathing exercises, tool number 2, those did help. Mm-hmm. What was the third tool that really helped move the needle with your tinnitus treatment, Brad?
Sleep strategy. And Suzanne May told me, she said, set your bedtime and stick to it. And that's a huge help. You've got to have rest and good quality rest when you're going through this program. It's so important. I don't think it can be stressed enough. And, she really drove that home to me. Get to bed. Really that simple.
How many hours a night have you been sleeping on average since you took that advice?
Oh, just roughly 8,
Okay. That's good.
Yeah. It's great advice.
Yeah. And what is your approach to using sound therapy when trying to fall asleep at night?
I don't use it at night. I'm going to, because I just recently got the headband. Well, it was some time ago from Dr. Suzanne, and I want to wear that when I sleep. Even though I don't have a problem with it, obviously when I'm asleep, but the noise or the sound is something I've really become accustomed to, and I count on it. So these maskers don't come out during the day, not at all. From the time I wake up to the time I go to bed. And truth be told, I probably don't need them in all the time now, but I like them. I don't want to go backwards.
Well, you've shown great results so far. You're not going backwards. You can work with our audiologist from our team to reduce the sound therapy over time. And that is what we want for patients. That's what we want for folks who are listening, is to think of it like there's something that malfunctions in the auditory system. And tinnitus is the presentation of that. If I break my wrist, which I've done on both wrists, I needed to wear a cast to get me through the healing period, right? But at the end of the treatment, yes, I needed some rehabilitation. I wasn't 100%, but I didn't need the cast anymore at some point. And the exact same thing applies to the sound therapy. I see it as something that promotes the treatment effect. That cast wasn't healing my bones. My bones were healing my bones. Do you know what I mean? My body was healing itself, but the cast allowed it to in a safe, directed manner. The sound therapy does just that. The guided breathing and the sleep strategies, they do just that. They allow the brain and the ear to naturally heal itself through the brain retraining, through the reduction of tinnitus. That is how we do it. And I think that puts it into a big perspective, because many people might see things like CBD or, a wristband or chiropractic adjustments as a moment in time solving the problem, something quick and fast, something that's getting right to it. But the perhaps mysterious thing about tinnitus treatment is that the more basic fundamental things like sound therapy, like guided breathing, like sleep strategies, move the needle and reduce tinnitus in a much better manner. So I want to pass it to you to share your wisdom, share your insights, your advice you have for your former self, really. Think about folks who are listening. If you're watching on YouTube and this has been helpful so far, please comment helpful. Brad, what advice do you have for someone struggling with tinnitus who's had it for over a year or has a significant degree of tinnitus?
Well, kind of like you said, a moment ago, if you're going after a solution for this that has the appearance that, oh, if I order this, I'll take it and it'll be over with in one day. Don't. It's not going to work. You know, do even things that, the guided breathing, the sleep, it all helps. It all does. And above all, the sound therapy, all I can say is it works. I don't know how else to put it. And like say, if it helps one person, wonderful. It helps one person. Yeah, just do it and stick with it. It's not going to happen overnight, but it will. It did for me. I know that.
Well, for folks who are interested in a consultation with a Treble Health audiologist, we'll have the links below and the numbers on the screen. You can reach out to us. We'd be sure to help and evaluate your case. Every tinnitus is unique, so having a personalized treatment is the recommended path forward. Brad, I want to ask you a few final questions here. You tried some tools at the beginning of your tinnitus journey that, looking back, were either a waste of time or money. What were those things that didn't work for you?
Diets. Different diets, just overall nutrition, eating better food, supplements like essential fatty acids, minerals, no luck. Medical grade CBD, everything I read about it is supposed to be a miracle. Didn't budget. The Neosensory wristband, a little bit, but not lasting, and I finally just gave up on it. And blue light therapy from my chiropractor, which I think helped because I wanted it to help, but I don't know how much it helped. And those all are pretty much, impulse buys or impulse treatments. I'm going to be better tomorrow if I just do this. And it didn't work.
What advice do you have for someone who is trying to solve their tinnitus quickly, looking for a solution like that? What would you say to them?
You're going to remain frustrated and upset, because there's nothing. I'm just convinced of this. I'm not a physician, but there's nothing out there that you can take one day and this will be gone the next. It just, there's so many people that search and search and search and try this and try that, and it's just not there. So don't give up on trying to find help, but don't go to those things that that are just, overnight cure. It's not going to happen. You've got to put the work in. It's just part of it, but it's worth it. And if you put that work in, you'll see. Don't give up.
Brad, were there moments where you wanted to give up, or you felt like you hit a roadblock and there was nothing else to try?
Yeah, there were moments I did give up, and it's just. I know it sounds, it's just ringing in your ears. Yeah, it is. It's not cancer, but it's just really debilitating, mentally more than anything. That's the struggle. And then, your energy goes down, everything just starts going down, and it's a circular firing squad.
I had a patient once who told me that their tinnitus journey was more challenging than their cancer diagnosis. And I hear all the time from my patients that because we can't escape it or stop it, that is the reason it's so mentally challenging and just never escaping.
Yeah.
However, your story is one that points to someone who had it for multiple years. It didn't budge. Then you got the right tools and you experienced a significant treatment that's lasted. So let us shout this from the rooftops, because all of the negative information about tinnitus online, for every negative story, I believe there's many positive ones as well. Brad, do you have any last words here from what you've learned, or for our YouTube community who's watching?
I would say a big one for me was stay away from the certain forums where people really get down. It doesn't help you. It's just going to depress you further. And just don't give up. Just don't give up. It can happen for you. Just put the work in, and You'll get there. You'll get there. I'm at the point now where, like my audiologist said, this is like when car alarms first came out. Car alarm goes off, everybody, now you hear a car alarm, you don't even hear it. It's the same thing with tinnitus. I don't hear it.
It's the same function of the brain, and it really shows us how the brain can be trained. Tinnitus can be reduced, not only the awareness, but often the volume as well. Brad, thank you so much. I'll be sure to update Dr. Suzanne on our team at Treble Health, who you worked with, that we met. And for all of our listeners on YouTube, we'll see you guys in the next Treble Health podcast episode.